The federal government of Nigeria has called for the need to address the stigmatization and discrimination of drug abuse patients so as to curb the menace in the interest, well-being, and development of Nigerians. This was part of the message passed during this year's ministerial briefing held in Abuja to commemorate the World Drug Day. The theme of this year's lecture was People First: Stop the Stigma and Discrimination, Strengthen Prevention. The guest lecturer, Mrs. Miriam Ilubuhi, spoke extensively on the damages posed by the stigmatization and punishment of people involved in drug abuse and suggested counseling as a better approach. Mrs. Miriam Ilubuyi, during her lecture, insisted that harmful drug users shouldn't be treated in an inhumane manner.
This is a human being. Before we now say this person, is someone who uses drugs. Before he started using drugs, he was a human being. Right now that he's using drugs, he's still a human being. And even if he agrees now or later to come into treatment, he's still a human being.
In her remarks, the Permanent Secretary of the Federal Ministry of Health, Engineer Olufunsho Adebiyi, represented by pharmacist Olubunmi Aribiano, Director of Food and Drug Services, Federal Ministry of Health, said despite the achievements, Nigerians need to realize the full impact of these efforts, stop stigmatization and discrimination, while strengthening prevention. She said all stakeholders need to adequately consider raising awareness about the negative impact of stigma and discrimination on people who use drugs and their families.
Despite this achievement so far, for Nigeria to realize the full impact of this effort, stopping stigmatization and discrimination while strengthening prevention, all stakeholders need to adequately consider the following steps. 1. Raise awareness about the negative impact of stigma and discrimination on people who use drugs and their families. Review the National Drug Law Enforcement Agency to recognize drug use and drug use disorder as a public health problem. Raise awareness about the HIV/AIDS and hepatitis epidemics among people who use drugs. Empower young people and communities with evidence-based information to prevent drug use and addiction. Improve surveillance and enforcement of controlled medicines laws, regulations, and policies to curb the non-medical use of controlled medicines.
Furthermore, the Director of Food and Drug Services, Pharmacist Olubunmi Aribiano, in her own capacity, charged everyone to participate in eradicating and taming the menace.
In Nigeria, and as long as we take it as someone else's problem, we will not get to the end of it. Why am I saying this? Drug abuse, as we all know, there's no family here that will say you do not have one person in your family, whether your child, your cousin, your nephew, your niece, there's somebody in your family that is involved in it. And the earlier we all join hands to ensure that we might not bring an end, reduce it to the barest minimum, the better for our society.